Hello, viewers. You are welcome to Koyem Ranch. If you are new to this channel, please like, share, and tap the subscribe bell to receive notifications anytime we download a new video. In this episode, we're going to share information about common diseases in goats, being a continuation of our first episode regarding goat diseases. Before I begin with this subject, I would like to issue a disclaimer that I am not a professional veterinarian. The subject is based on my own personal practical experience and researches conducted. So, therefore, in dealing with good medication and treatment as a farmer or an individual, you need to consult your veterinarian. Diseases we shall treat include tetanus or Clostridium tetani, sore mouth, also known as contagious eczema, caseous lymphadenitis, also known as corona bacterial. Tetanus, also called Clostridium tetani, is a bacterial infection which affects the nervous system, commonly known as the lockjaw. In goats, tetanus is also known as the stiff lamb disease or Clostridia myositis. It is found in soil and animal feces. The disease affects both humans and animals. The bacteria of the disease enter the body through wounds caused by thorns, nails, and other sharp objects. It is a preventable disease that can lead to sudden death in unvaccinated animals. Symptoms. Symptoms of tetanus can vary depending on the severity of the infection. Early signs in goats include stiffness and muscle spasms. The bacteria may enter the umbilical cord of the newborn babies. The goat may be reluctant to move. It becomes locked up or lockjaw. It develops muscle stiffness, eyes twitching, difficulty swallowing, inability to eat or drink, stiff gait. The goat may have seizures and then eventually collapse or die. Treatment. Treatment involves the administration of antibiotics and antitoxins. Supportive care such as fluid and pain management. In severe cases, a goat may require hospitalization assisted by ventilation. Treatment must start as soon as possible to increase chances of recovery. Vaccination is the most effective way to prevent tetanus in goats. Vaccine is always given in combination with with other Clostridia vaccines, such as 3-in-1. It should be given to all goats, including pregnant does, to protect their offspring or children. Prevention. Prevention is done through proper wound management and vaccinations. All wounds should be cleaned and disinfected to prevent entry of the bacteria. Goats should be vaccinated regularly to maintain their immunity. In areas with high soil contamination, it may be necessary to reduce the exposure by keeping goats in clean and dry environments. The most essential vaccine is the 3T Clostridium perfringens type C and D tetanus toxide, and detoxified. Sore mouth, also known as contagious eczema or ORF, is a viral disease affecting the skin primarily around the mouth, the udder, and coronet, and is prevalent in all countries where sheep and goats are raised. In addition to sheep, goats, and related species, humans also are susceptible to the infection through contact with infected animals or termites. Causes: it is caused by a virus in the pox family and is zoonotic or can infect human beings. It is spread through direct contact with infected animals or viruses contaminated with termites. Infection will establish only at sites where the skin is traumatized. Clinical signs and symptoms. Typically, it infects young animals and more severe in sheep and goats. Symptoms appear about 4 to 14 days after infection. Thick scabies, sores on lips and gums are produced. Lesions on the udder, which may result in the abandonment of offspring. When it happens like that, the breast produces lesions, and as a result, the goat or female goat will abandon the children for breastfeeding. Pimples around the nose, as there is a development of pimples around the nose, the mouth, the eyes, anus, and hooves. These pimples turn to watery blisters, then to sticky, encrusted scabs. The mouth and gums get swelling. It can cause death if the animal is unable to eat. The goat find difficult eating. Spreading lesions to the door's odor. Control and prevention. There is no cure for the virus. Supportive care is the most common and fairly manageable. Supportive care must be applied and is the most common and fairly manageable. Implement quarantine measures and isolate the goat to help prevent the spread. Treat blisters with ointments and antibiotics to prevent the bacterial infection. Vaccination recommended. Ovine eczema vaccine, cefepime benzathine vaccine are all recommended. Vaccination is to be carried out on dogs 6 to 8 weeks before kidding. Caseous lymphadenitis, known in common terms as CL or cheesy goat. or in our common parlance, goat boil. It is highly contagious and can infect both sheep and goats. It is caused by the Corynebacterium pseudotuberculosis bacteria or disease. The bacteria enters the goat through breaks in the skin or mucous membrane and localizes in the lymph node, thereby causing abscesses. Abscesses develop on both the internal and superficial lymph nodes. The disease appears most commonly on the lymph nodes around the face and the neck of the goat. Internal form of this infection is more common in sheep and can also occur in goats. How it spreads. The bacteria enters the body through wounds or the lesions on the skin. May enter through micro abrasions in the mouth when the animal is feeding. Pus from the infected goat will spread the bacterium onto others. The bacterium enter the bloodstream and travel to the lymphatics. Symptoms. The bacteria cause abrasions on the lymph nodes. Progression of the infection develop pus production from the abscess. Abrasions release yellow, odorless, cottage cheese-like pus. That's the origin of the name or the term cheesy goat. The animal will lose weight. It becomes lethargy or unable to feed, depending upon the organ affected. Treatment and prevention. The disease is considered not curable. Have a veterinary officer to test if the abscess is CL. Isolate the goat. Lens the abscess and remove the discharge. Surgical excision is another way, another option to treat. Then treat with iodine several times. Destroy all discharges. Strict biosecurity measures have to be implemented. Consult your veterinarian if possible. You can also resort to vaccinations. Thank you for viewing. If you have any comment, please drop it in the comments box and stay tuned for other episodes. Bye bye.